Hi, my name is Mary Boschman, and I am a Master's of Social Work student at GCU. And this is a discussion question one for Social Work 601, Advocacy in Social Work. To answer the discussion question, I think that advocacy is definitely one of the most important responsibilities of social workers because many of the individuals and communities that we serve face significant barriers that make it difficult for them to access resources, services, or even have their voices heard at all. Social workers are definitely in a unique position to help empower their clients, reduce systemic barriers, and advocate for social justice. Um, Advocacy occurs on multiple levels, micro, meso, and macro. You including advocating for individual clients, communities, and making changes in policies and legislation that impact our vulnerable populations that we work with. Although I personally have not worked yet in like a social work role, because I have my bachelor's degree in psychology, I have had several professional experiences in my work history that involved advocacy for clients and have definitely strengthened my understanding of how important it is to advocate for our clients. One example was when I worked as a LCDP, which is a licensed chemical dependency professional at a methadone clinic. Um, I assisted with case management services, and I regularly advocated for my clients who were working hard towards their recovery and to get their lives back. Many of my clients were actively trying to reunify with their children, maintaining good standing on probation, secure stable housing, and overcome a lot of barriers that were related to their active addiction. Um, they didn't have transportation, so I would help them with bus passes, and they had a lot of financial hardship as a result of all of these issues and barriers. My role often involved connecting those clients with community resources and mental health providers, collaborating with other professionals and helping them to navigate systems that maybe be difficult for them to do on their own and they might have needed a little extra help with that. Advocating for my clients meant making sure that they had the support and opportunities they needed to continue to make progress towards their recovery and reunify with their children, stay out of jail, and get meaningful employment, gainful employment, housing, all the things that were in their treatment goals. I also work currently as a registered behavior technician in public schools, right now at the middle school level, where advocacy looks a little bit different because I currently work with students who have autism and other developmental disabilities, and I advocate for them to receive the accommodations and supports that they are legally entitled to through their individual education plans or IEPs. Um, Every child is unique and they deserve an opportunity to succeed. And advocating for appropriate educational services and supports really helps make sure that they can participate meaningfully and in their education alongside their peers and promote meaningful inclusion alongside their fellows in school. Recently, during my first field placement with the Department of Children, Youth, and Families, I had the opportunity to participate in the Child and Family Services Review, which was called the CFSR, which focuses on, it's a federal review process that focuses on reviewing like 200-ish cases, and you're paired with a federal partner. And the two of you, the federal and the state partner, work together to really thoroughly analyze cases through an 18-item instrument and see where we could improve our practices, like the areas needing improvement, or where we had strengths, and what kinds of policies could be changed or implemented to get those areas needing improvement to become strengths. We got a lot of feedback from stakeholder groups, from youth, foster families, community providers, judges, all sorts of people in the community saying their experiences and where we could implement improvements. And that can positively impact thousands of children and families that are involved in the child welfare of Rhode Island. Um, all of these experiences reinforce my belief that advocacy is truly the center of social work, whether it's helping one client overcome barriers, making sure a student receives their appropriate accommodations in class, or contributing to policy improvements that can strengthen child welfare agencies and improve outcomes for children and families in the state. So, as I continue my education and work towards becoming a school social worker, which is what I really want to do, I hope to continue advocating for students in my next internship with the school and their families by ensuring that they have access to resources and supports and equitable opportunities that they need to be successful and have positive outcomes. I look forward to learning more about that. So, thank you.